In this video, I'm sharing 3 exercises that will help you decrease your hip pain while squatting. Now, if you're new here, my name is Dr. Brian Larish, and I'm the owner of a cash-based physical therapy clinic, as well as the creator of the PT Growth Academy. Now, I've worked with hundreds of patients and clients that have hip pain while squatting, and I've been able to really use these exercises to help change their mindset, but ultimately change their position and get them out of pain. Now, before we discuss the 3 exercises, let's first talk about the source of hip pain while squatting. So pain is a multifactorial experience. This means that it's usually not one single component that creates pain. And a squat is no different. There are tons of internal and external forces we have to go against, and if something isn't doing what it should at the perfect time, we tend to experience pain. So my quick disclaimer for this video is that I really want to talk about a common underlying pattern that really affects the masses. However, if you have something specific going on, I would encourage you to do 2 things. 1, seek out a physical therapist locally and get an assessment so you can understand what is going on, or I'll leave the link below if you want to set up a virtual assessment. And what this allows us to do is better understand your pattern, the specific pattern that your pelvis and everything else is following, so we can give you more specific exercises to get you out of pain. Like I said, I'll leave that in the link below if you want to schedule that. Now, back to the video at hand. I really want you to walk away understanding the natural asymmetrical bias that we have. This asymmetrical bias is usually not a problem until it's a problem. Meaning, when we start to compensate too much, we start to have pain, and that's when we really want to start at addressing this. This common pattern is where the left pelvis is slightly in front of the right. And so we have a right bias when it comes to the pelvis. And this leads to a lot of compensations below and above, and there's a lot of ways we can kind of go from here. But the underlying issue is this. What does this usually do when it comes to pain? Normally people have right anterior hip pain. This is because when we shift to the right, we actually close down the space in the front, and conversely, if I turn this around, we open up the space in the back. And so what does this mean? This means that we usually run out of space on the right side in the front quicker than we would on the left. So we usually feel that pinchy impingement sensation. Now, you might be watching this video and be like, I don't have right side hip pain, I actually have left. And that's common too. However, it's still usually because we then kind of deviate and compensate because of this underlying rightward turn. So whether you're a physical therapist, a personal trainer, or someone just looking to get out of pain, I think it's really helpful to understand this. When we understand this, we can choose better exercises. How? Because we're not just guessing. We're not just blindly stretching and randomly doing things to hope that it gets us out of pain. Instead, we are choosing exercises to directly oppose the pattern. And that brings us to our next section, the goal of the exercises. So there are 3 main goals that we want the exercises to do. First, we need to increase our awareness of the pattern. Are we in this right side back, left side forward pattern? We can't change anything until we're first aware of our norm. If your norm is hip pain when you squat, then we need to recognize, how are we setting our feet up? How wide are we setting our feet up? Are we kind of feeding into this pattern? And so increasing awareness is something that a lot of people forget about, but it's really key for long-term learning. Goal number 2 is starting to expand. We need to expand what is compressed and compress what is expanded. What that means is when we have this right turn, and this is exaggerated so you can really understand how this looks. So we have compression in the front, and if we turn this around, expansion in the back. And so we're just looking to do the opposite. So if we choose an exercise, we want to start to compress the right backside and expand the left backside. And it does just the opposite. When we compress the right backside, that means we actually start to open up the right front side. And so we are looking to expand. Goal number 3 is then strengthen. We want to learn and strengthen our body so we can actually maintain a better position, which creates a better pattern. And you can think of it almost as posture. I don't like the word as posture as much, but we are trying to change a new pattern. And so we have three primary goals with the exercises we choose. Number one, awareness. Number two, expansion. Number three, strengthen. So the first thing we're looking to do is increase our awareness. It's actually really simple, but really powerful. All I want you to do is to go ahead and stand in a position that you would call relatively relaxed. Don't try to bias any sort of things, just go in a relaxed position. And then I just want you to think about a couple things. Number one, do you feel like you are evenly balanced, or do you feel like you have more pressure on the left side or more pressure on the right? So evenly balanced would be 50-50 pressure. Or do you feel like you're 60-40? Do you feel like you're 70-30? So increase your awareness. Where do you feel from a pressure standpoint, left to right? Now take it one step further and understand, where is your pressure on the left foot? Is it the toes, midfoot, or heel? Same question on the right. Is it the toes, midfoot, or heel? And lastly, one step further, if we think about the left foot, do you feel more supinated or more towards the outside of the foot with a higher arch? Or do you feel more pronated? Same question on the right side. Do you feel more supinated, higher arched, or more flat arch, pronated? Just by understanding these sensations, we can start to increase our awareness. And you may walk away from it being like, holy cow, I am like totally on this right side and I totally feel flat here. And all of that helps us understand what's going on at the pelvis. And so we can start to carry this through to exercises. What's happening when we're under load? Are we totally shifted out of it? Chances are that we probably do have some sort of difference left to right. And that's why increasing our awareness for long-term change is so crucial to get out of pain. Now we're moving on to goal number two, expansion. Remember, we are trying to expand what is compressed and compress what is expanded. What this means from the pattern that we talked about is that we are trying to expand the left backside of the hip. And that's why a hip shifting stretch is really good. It's different than just a static stretch because we are moving into a very specific pattern compared to blindly stretching both sides. Now, for this exercise, we'll need a foam roller or a yoga block, something to elevate the knee. What we're gonna do is slide the foam roller over, place the left knee on top, and then the right knee is gonna go slightly in front with the foot staying on the ground. Now, from here, it's a pretty simple exercise. We're just slowly pushing the right knee towards the ground, and when we do that, we should feel a left back hip stretch. And then once we're down there, hold for about 10 seconds, breathe through it, stay calm, and then push the left knee into the foam roller to bring the hip back to its neutral position, and then you're going to repeat. Now, the biggest mistake in this exercise, and if you do this and you don't feel that left back hip, it's because as you bring the right knee down, you're probably shifting your body weight with it. This tends to happen when people are really compressed, really tight. So what you want to remember with this exercise is that less is more. Really focus on moving the knees like they're pistons, not turning the whole body. Now, as you go through it, if you start to feel that hip shift, I would try to recenter over that left side, trying to feel really heavy. That's the thought. Heavy and slow movement, staying over this left side. Now, if you have any sort of knee problems or any sort of problems being here, let me show you one quick modification. So if you can't tolerate that position, no problem. Find a table, a bench, a plyo box, a desk, anything that you can be in this relatively 90-degree position, and just let your elbows rest on it. From here, it's the same thing. We just don't have all that pressure on the legs. You are going to bend one leg and you are going to push straight down, and you're going to come back up. And so for the pattern that we're trying to oppose, the right leg would be up, and we're pushing the right knee down like a piston to feel that left back hip of the stretch. Same rules apply here. We don't want to shift and come off of that left side. You want to stay heavy over that left side, so that way when you push that right knee down, you should feel a stretch right back in here. So our final 2 exercises align with the final goal, which is strengthen. What we're gonna do is a clamshell with a reach. So throw a band around the knees and then go so your feet are on the wall or something. So I have a plyo box here representing a wall. This is actually really crucial because when we plant our feet and our feet are on something, on the ground, on a plyo box, on the wall, we move it towards more of a closed chain exercise. So we get more of the pelvis compared to the femur. So that's the thought there. Once you're in this position, you're gonna go in a relaxed position here. Bring your feet so you're at a 90-degree angle. You're going to tuck the tailbone, bring your belt buckle towards your chin, lift that right knee, and then the thought here is that we're maintaining this position. So we're not dropping and we're not lifting. And as we do this, we are reaching forwards. And there should be a correlation. The further forwards you reach, the more glute you feel. Now, how does this relate to the reason behind all of this? We are compressing this right side and we are hip shifting forwards on the right, backwards on the left, right? And so all we're doing is going forwards, feeling that position where we start to feel that burn. Ideally, it's where the right knee is slightly in front of the left, and then we're gonna slowly come back. We're going to slowly push it forwards without dropping down. Hold that bottom position for about 5 seconds and slowly come back. Now as you do this, really focus and make sure you're not arching through the pelvis. If you need to, use this other hand to really feel this more counterclockwise turn and that posterior pelvic tilt. So the final exercise that aligns with the strength goal is a kickstand deadlift, specifically with a foam roller against the wall. What this does is this really makes sure that you are turning the proper way. When we turn, if these are the hips, ideally the hips should turn like this. If we don't do it the right way, instead of this reciprocal motion, we actually just do this. And so this is a really easy way to make sure that we are performing this the right way. So what we're gonna do from here is we have a little bit of inward pressure as we go down to hold on to that. And that's gonna give us more of this reciprocal rotation. So what you're gonna do, grab a kettlebell, grab a dumbbell, place the other foot so you're on the toe, the front foot, you're on the heel to midfoot. All you're doing is pushing the hips back without this front knee bending too much, right? The more we start to bend the left knee, the more squat we are actually doing. So we are trying to do a hinge with that rotation. So the kettlebell is aiming for that second toe. I feel that left glute stretch. I have a little bit of inward pressure into the foam roller, and then I come back out, and then we repeat. Continue driving into that foam roller. As we go down, search for that left glute stretch / burn. That means we did it right, and then we come back up. Also, back to our knee moving too far forwards, you'll start to not feel that glute nearly as much if you bend the knee. We're turning into a squat at that point. We are trying to hinge, so we want to have an unlock knee, not a hyperextended knee, an unlock knee that stays pretty much where it is as you go through the motion.